Well, the topic allotted was leading role of India in organization of humanitarian cardiac surgery in Asia. Well, Asia is a continent of undammed aspirations, yet coexisting stark realities we see today. Congenital heart disease is a major cause of infant mortality in Asia. Over 250,000 children are born in India alone with congenital heart disease every year. Limited access to pediatric cardiac care in a low resource Asian nations. Humanitarian collaborations emerging to bridge this divide, and India is positioned as a regional hub for cardiac care excellence in the coming days. Well, if you see the facts across the globe, as we heard in my previous talks, India it is among the low income group countries. Seeing the annual incidence, in fact, if you find the low income countries case contributes close to around 8 lakhs, and incidence from India itself is around 2 lakh 50,000 every year. And 1 out of 5 children worldwide born with congenital heart disease is from India. Now, what is the concept of humanitarian cardiac care? Care as means of service, not commerce. Equitable access for all, irrespective of socioeconomic status. Partnerships based on compassion, training, and shared knowledge. Focus on sustainability and skill transfer. And Satyasai Sanjeevani group of hospitals embodies this philosophy. Just the beginnings of cardiac surgery in India, the epitome of philanthropy and altruism. We see here Dr. Reeve Betts was a missionary surgeon who established the first cardiothoracic department in CMC Vellore in the year 1948, immediately after 1 year of our independence. Dr. Padi was an immigrant from Canada who established a standalone center at rural India, that is a place called as Miraj. Miraj is a place in Maharashtra. Once upon a time, either patients would go to CMC Vellore or Miraj. These were the two cities which were looked back about 30 years back, 30 or 40 years back. Dr. Gopinath, the first Indian cardiothoracic surgeon, received training under Dr. Walter Nilai and returned to India, spending his time in All Institute of Medical Sciences, New Delhi. Dr. M.S. Valiyathan and Dr. K.M. Cherian left lucrative careers abroad and to establish institutes in India at Chitra Institute in Trivandrum and to begin with at Railway Hospitals, subsequently the Frontier Lifeline Hospital at Chennai by Dr. K.M. Cherian. Many initial surgical programs started where at most of the times it were at public institutions. Coming to the Indian landscape, excess of cardiac health disease care in India, as we see, we have public, private, and philanthropic centers across India. Initially, pediatric cardiac surgery was localized mainly to South India and just one center in North India. And of late, across the country, as the specialty has been growing, we have centers across the country, and even at two-tier cities, we do have pediatric cardiac care centers today. States are with 25% of Indian congenital heart disease have no infrastructures. Now, child with a congenital heart disease, how can we classify them at our various centers in the country? Government centers, the standard centers are all institute centers, initially starting with Delhi. Now there are many centers across India. The UN Mehta Center at Gujarat, Sri Chitra in Trivandrum, Safdarjung in Delhi, and Jaydeva and other hospitals at Bangalore. In private sectors, we have Fortis, Narayan and Max, and of course, philanthropy come private are Ambani Group of hospitals. Trusts are Satyasai Institutes, Amrita Institutes, and Wadia Group of hospitals. And camps being conducted across the country and across the globe, of course, are Healing Little Heart camps and Smiling Little Heart camps which will be conducted. The infrastructure is performing around 65,000 surgeries annually for congenital heart disease. Well, what literature I could search was philanthropic organizations across the world. We have close to around 56 to 57 centers. There are many centers. I would not like to name them. In few of the well-known centers like Global Healing Centers, Global Network, Healing the Children, or Heal a Child, Heart Funds, and of course we have Healing Little Hearts, Smiling Heart Foundations from UK, and Kalangos Heart Foundation from the Greece. So there are a number of centers who come up and try to do this philanthropic work at their local hospitals or local institutes, and also some go beyond that and cover up many of the countries. An OD between public and private involvement in philanthropy, these are the stalwarts who had helped in India and setting up centers at Sri Satyasai Institute of Medical Sciences, whether it is in Puttaparthi or in Whitefield or in Sanjeevani group of hospitals across the country and even outside country, which are close to around 10 to 12 till date. What are the models of excellence? As we see, that is the CMC, Vellore Hospital, the Amrita Institutes, the Satyasai Institutes and Sanjeevani group of hospitals. An overview of Satyasai Sanjeevani group of hospitals at currently where we are working is network of totally free of cost pediatric cardiac institutes, centers at Palwal in and Naya Raipur, Navi Mumbai, here at Muddenalli close to Bangalore, and also another center at uh, Telangana, which is Siddipet, Telangana, which started recently. The mission of this Sanjeevani group of hospitals is no child should suffer for want of care. Over 40,000 surgeries and interventions have been performed till date. It integrates care, research and training under one mission. The core philosophy of Satyasai Sanjeevani Hospitals is love and service as a driving force, healthcare as a humanitarian right, no billing and no discrimination, integration of spiritual and scientific excellence. These are our masters, Bhagwan Satyasai Baba and his disciple Sadhguru Madhusudan Sai, who is leading the mission right now. Focused on total child care, diagnosis to lifelong wellness. Coming to India's leadership care in cardiac surgery is advanced tertiary care infrastructure and expertise, fruits of frugal innovation, cost cutting, and sustainable models. Cutting costs, not quality, that's the priority where we look at. Surgeons trained in socio-economic and cutting edge skills. And of course, Indian humanitarian missions can inspire many more Asian nations. That's what we set up as a role model. Humanitarian collaborations with governments in Asia are with missions with Sri Lanka, in Nepal, Fiji, Indonesia, Uzbekistan, and Philippines. Surgical camps and telementorship programs are in place, joint operations with local teams, and patient referrals from nations without centers is in progress. Development of regional self-reliant centers also are in place. Satyasai Sanjeevani hospitals have international engagements, outreach at Fiji, Sri Lanka, and Nigeria, visiting surgical teams from India and from other countries, from Greece or from USA or from Australia, training and mentoring local medical professionals, promoting heart-to-heart models of transnational service, establishing frameworks for sustainable pediatric cardiac programs. Coming to capacity building and skill transfers, training of surgeons, anesthetists and perfusion nurses, through these camps especially we take a call where team from different parts of the world, whether it is USA, Australia, New Zealand, Czech Republic, they do come down on regular basis, and we do hold hands-on workshops and online training programs have been conducted on regular basis in India. Knowledge exchange through Sanjeevani training centers, creation of satellite centers in developing regions, that's where we are looking at as primary and secondary tertiary centers which we are looking at, empowerment through education and mentorship. In fact, during this training process, when the team from the other countries come down, we do have collaborations and we send our students for research or for fellowship programs to their centers. That's how we get trained. And it's not only that, it's a matter of exchange of knowledge wherein when their team members come down, they look into the cost cutting factors, because today economic status of even so-called developed countries are going down. So in that condition, they are looking at cost cutting measures, how we can, and we stand as a role model for cost cutting measures, giving the high quality care. That's what they learn from us when they spend time with us on regular basis. Of course, remote diagnostics and case discussions are in place. Cloud-based data sharing with with partner hospitals. Telemedicine is another thing which we are already into, and we do have consultation through telemedicines on follow-up cases and even in pre-op cases. What we look at, strengthening regional healthcare capacities, digital humanitarian bridging geographic barriers is what we look at. What are the academic collaborations of such institutes? We look. Partnership with All India Institute of Medical Sciences, PGI, and international universities is in place. Joint publications and research in pediatric cardiac outcomes. Global symposiums on humanitarian medicine, as this is one of a setting example what we are having today. Integration of ethics and empathy in medical education, promoting India as a knowledge of compassion hub. Community outreach programs and early detection of congenital heart disease. A nationwide congenital heart disease screening programs is being conducted regularly. Rural diagnostic camps and antenatal awareness, collaboration with schools and NGOs which are in place, early referral and transport assistance, holistic approach to community cardiac health care. These are things which we are looking at and working on. The Mother and Child Health Program is one of the major programs of our institute. It emphasizes on maternal health to prevent congenital heart disease risk, and of late research in our own institute happened to see that deficiency of vitamin B leading to the increased pulmonary artery pressures, and which can be supplemented in our day to day in our antenatal programs. That is one factor where they have looked into. There are other Sanjeevani mother and child initiatives in multiple states. Of course, nutrition is taken care, prenatal care and education, and continuum of care from womb to wellness. That's where we look at integration with government schemes, which is another role model which we are following. Model replicable across Asian settings, it's where we are working on. Well, we all know this was the first rural medical college free of cost model set up in the world. It's totally 100% charitable, donor funded system, sustainability to trust and transparency. Volunteers and global philanthropic networks are into place which help us. Proven operational efficiency without compromise, and template for other humanitarian hospitals in Asia as a role model. Coming to ethical and spiritual dimensions, healthcare as a divine service, that seva, what we call it as. Every surgery performed in the spirit of gratitude, healing beyond medicine, emotional and spiritual care, patients treated as family, not as beneficiaries. To set an example, we do operate children from our institutes in our institute, and also grown up congenitals, and there are certain living examples where they come back and do service on regular basis at our institute. Not only that, there are certain patients whom you have operated, and they come down, and if they do not have a job, or if they are capable of finding a job, even job opportunities are picked up, and to see that they return back to the institute as a gratitude of seva at various places in different institutes. That's how we are setting a load model, and this is the ethical and spiritual dimensions where we are looking at. Government and policy interface, as our founder Sadhguru Madhusan Sai tells, the three S's, that is the society, the sanstha, that is the institute, and the government, all together they come down to support through these different schemes of Ayushman Bharat or CSR frameworks, recognition by Indian health authorities, advocacy for inclusion and humanitarian models in national planning, encouragement for international health diplomacy. So these are the various things where government facilities can be utilized in a proper way, and that can be taken forward to support every child who is in need. India as a moral and medical leader in the region is really a role model in most of the countries today. A few snapshots of the humanitarian mission at work. At Fiji Revival of Pediatric Cardiac Care, we have a senior cardiac surgeons, Dr. Kalangos, Dr. Sean Shetty, who visit Fiji regularly to conduct camps in our hospitals there. Sri Lanka joint camps post civil war was been conducted. Even Nepal post earthquake congenital heart outreach activities were conducted. Even in Indonesia, local team training initiatives. Each mission fostering long term independence. That's where we are looking at. Training the next generation is a challenge by itself, and that's where our institute set up the world's first free medical college, and structured fellowship program and observers programs are being implemented. Leadership training programs in compassionate healthcare, young doctors inspired towards service-based careers, launch of world's first free medical school as mentioned, rural medical service as a means of bridge the divide, mentorship under Sanjeevani senior surgeons, that's what we are doing at present, fellowship residency and score like programs. Skill plus heart is the education model what we are trying to build up. Well, training the next generation, this was taken an initiative in Satyasai group of hospitals around 10 years back, where SCORE program, it's to be, we named a mnemonic called as SCORE, called as Satyasai Rapid Examination Orientation Program. This is one of its unique program, and one of the best programs for any trainee resident in the country. There is no uniformity of training in our country. That's what even Dr. Shivkumar Sivalingam mentioned, that challenges what we face. So to get that uniformity and plan because the students are not aware of how they face their exams, what cases, discussion per se, and subsequently even on career guidance has been done in these programs, and this we have been conducting for the last 10 years plus, making young surgeons future ready, removing stress from exams, ushering competency, and invariably the students who attend this core program, the pass rate is close to 95 to 99%. Volunteerism, as we know, we have several groups of strong team members who support us. It's an integral part of hospital ecosystem, administrative, paramedical, and community support, global Sai youth participation, building empathy and collective responsibility. Volunteerism as a force multiplier in healthcare delivery, and Sevadal as Swasthabal. That's where we look at in integrating common man. And in our institute, apart from giving free education, our Sadhguru has made a policy of the students' parents to realize the amount of service what we are doing to the child. A gratitude from the parents to the institute is serving of the parents of each child in our institute minimum 15 days, maximum is at their choice, but that is made compulsory, and that really made an impact on transformation in the families also. Coming to innovations, indigenous devices at low cost surgical tools where we are working at. Frugal innovation in the country like TT Chitra by Dr. M.S. Valiathan, RA free wall patch in closing of an ASD closures by Dr. Sampath Kumar from AIMS Delhi, cardiopulmonary bypass and ECMOs by Dr. A.K. Bisoy and P. Venugo from All Institute. And at our institute, we are coming up with the first Make in India cardiopulmonary bypass machine, which definitely reduces the cost burden and quite user friendly, which will be unveiled shortly. Pharmacotherapy and for pulmonary hypertension and low cardiac output status, many of the guidelines laid for our country by Dr. Parvatiyar and Dr. Krishna S. Iyer, who morning had his talk. So these are the stalwarts which have really made a huge impact. Handmade PD catheter is another innovation in our country done by Dr. Suresh Rao. And of course, another thing I forgot to mention is the College chambers, where we use designed by Dr. Srikanth Kole in Maharashtra. I had a privilege to work with him, and he had designed a Coles chamber where blood cardiac pressure delivery system which is used to stop the heart, that has been reusable, and that's where cost cutting also matters a lot. Whereas one BCD, a blood cardiac pressure delivery device, costs us close to around 6 to 8,000 rupees, and this hardly and it's a disposable one, whereas this device by Dr. Kole hardly costs around 2 to 3,000 rupees, and it's a reusable. It's a glass chamber, and it can be reused in a sterile pattern unless it breaks. So another thing is rings. Each ring costs us around 40 to 60,000 rupees, and we have felt annuloplasty rings designed by Sampath Kumar where we use, and I have been using this for the last almost close to 15 years plus, and have a good number of cases with a good follow-up, especially in the mitral valve repair. And of course, we have Dr. Kalangos who is sitting among us, and he has designed a ring, the Kalangos ring, which is an absorbable ring, especially in tricuspid and mitral valve repairs. So pediatric cardiac database and registries are another thing. Innovations focus on preventive cardiology in children. That's where we are looking at, and innovation rooted in compassion. That's another thing we finally look. Coming to research, we have published a number of articles in various journals, and during the COVID times, we did have from our institutes the masterclass series close to 257 plus with multiple countries across the globe when we were not knowing what to be done. And in India, we set a guidelines paper. The article was written by me and a few of my colleague teams, and we had set up a guideline for cardiovascular surgery in the COVID era 19 the COVID-19 era. Not only that, in our country, we had the first Make in India bioprosthetic valve, what is called as a daffodil valve made from bovine pericardium. And we happened to implement maximum in the country. We participated in the clinical trial in the country among the 22 centers, and happened to implement the maximum in the country and got it approved by the DCGI government of India. And today it's almost more than 7 years, and we have a follow-up of 1 year, 3 years published data. The fifth year published data shortly will be released in another month. And of course, various cases, whether it is single case reports, or TTK Chitra is another valve which I mentioned, which was published in the Indian Journal of Surgery close to around 2,600 patients follow up for the last 20 years. That was the largest number published in the country of any valve been. Today we have some other valves also made in India, but those days we had only Chitra valve, which is a mono disc, single disc valve, which has been implanted close to around 2.5 lakh patients till date. In global acknowledgement, appreciating the WHO and various Asian health ministers, partnership with the global pediatric cardiac societies, cited as a model for humanitarian excellence and India's soft power through healing and service, expanding international collaborations. That's where we are looking at. Challenges ahead, the growing congenital heart disease burden in Asia, and as mentioned by our Sadhguru, we happen to start the heart valve bank totally free of cost, and we are working on logistics wherein heart valve required for any pediatric congenital heart disease across the globe. We are building up a system wherein we are coming up with an app shortly so that anybody across the world requires a valve can be shipped to that particular country. That's where we are. Our aim is. So one step at a time. So at present the bank is almost ready, and we will be subsequently seeing that anybody requires a heart valve can be transported to that particular place. Need for more trained personnel, funding sustainability and low economic regions, balancing service expansion with quality assurance, advocacy for governmental and private partnerships, vision for the future. Future is establish heart centers for all across Asia, strengthen telehealth and e-learning networks, collaborate with government and NGOs, foster self-sufficient pediatric cardiac ecosystems from India for Asia with love. That's where the mission is heading towards. Coming to data and outcomes, we have excellent survival and long-term outcomes, transparent reporting and audit cultures, benchmark results comparable to top global centers, demonstrates value of compassion-driven care, data used to advocate for policy change, collaborations with different STS, EACTS, IACTS, and development of IACTS database was taken in our institute and today and inaugurated by the Health Minister, Government of India way back in 2021. And today, because we did not have a database and we studied database of course 7 countries, made our own templates, the Indian template for database for congenital heart disease, for adult heart diseases, and today we have a collection of data of more than 40,000 plus. Shortly we will be coming up with the literature, and we are encouraging many more centers to participate. We do have certain rules regulations in the database participation, and that is in progress. Well, personal experience, been working in Satyasai institutes close to 20 years now, and the mission vision is Mana Seva is Madhava Seva. That's where we are heading towards. To conclude, India's leadership is rooted in compassion, not in commerce. Satya Sai Sanjeevani Group of Hospitals is a beacon of hope and healing across the globe. Humanitarian cardiac care, redefining global health equity, is a role model which we have set up. Collaboration over competition, service as legacy. Hearts heal when hands serve. Thank you for the attention, Saira.